Many people you care for will have poor vision, and some may even be blind. Many older people can lose their central vision and have difficulty seeing straight ahead, but they can often still see some things using their side vision. While side vision does not provide any detail, it is usually good enough to see a doorway or if there is someone in the room, even if they can't tell who that person is. Other people can have quite good central vision, but poor side vision. These people might have difficulty seeing someone walking towards them from the side. Some people can have a vision problem which makes everything look cloudy, like looking through a thick fog. Other people can have a vision problem which makes their vision patchy, where some areas of their vision are blurred or missing or incomplete. People with poor central vision often have difficulty reading, watching TV, seeing faces, the meal or medication you place in front of them, or anything that is small. People with poor vision also have difficulty seeing things like the edge of stairs, a low-hanging tree branch, a rock on the ground, or other hazards. Many older people with poor vision don't actually realise that their vision is poor. Others don't want to make a fuss, so they won't tell you they can't see things properly. It can be difficult to identify people with vision loss. There are signs which may indicate that a person isn't seeing well. They might fall or trip frequently, hold a book or newspaper very close to their face, not look straight at you. They might look slightly to the side of your face. Not want to join in group activities, especially if these involve reading, playing bingo, Scrabble or cards. Not want to go for a walk, even though they are quite fit. Have reduced care with personal grooming. Be frustrated, angry, anxious or depressed. If you think a person in your care is experiencing loss of vision, tell your line manager about changing the way care is provided to help keep them safe. People with vision loss should be encouraged to be as independent as possible. However, some will require special care to make their lives happier and safer. Here are some examples of how you can provide better care. Always tell the person with vision loss when you are approaching and let them know who you are. You can lightly touch their arm or address them by name so they know you are talking to them. Always ask before initiating care. Some people may not want or need assistance. Remember to let them know when you are walking away from them or have left the room. Encourage walking or other forms of light exercise and check if supervision or walking aids are required. Avoid placing people in wheelchairs if they can still walk, even if they cannot see well. If a person needs guidance with walking, you can touch the back of their hand with the back of your hand. This helps them know exactly where you are standing. If you are on the right side, you can touch their right hand with your left hand. Offer your arm to guide them. They can hold your arm just above the elbow. You stand in front and lead, walking at a pace that is comfortable for both of you. Watch out for narrow spaces and doorways. Don't forget to look for obstacles at foot level, head height and to the sides, and warn the person in advance. You can help a person take their medication by placing it in their hand, handing them a glass of water, and watch them safely swallow. Remember, do not leave medication in a container, as the person may not see them and accidentally knock them over. In consultation with the person, remove trip hazards in the room, such as power cords, rugs and other items. Don't change the location of personal items or move furniture in their room without asking, even if it appears to be tidier or safer. Check that commonly used items such as reading glasses, tissues, TV remote, clothing, footwear, etc. are kept in the same place to assist a person to easily identify and locate items when alone. Tell the person when you are placing a meal in front of them and explain what the meal is. It is useful to describe the location of where you have placed their food or drinks. Use plates and cups with contrasting colour to the table surface or tablecloth. Avoid using clear glass water jugs or clear drinking glasses. Don't fill cups to the top. Always let a person with poor vision know where you have placed their drink. This will avoid any unnecessary accidents. Offer to help with putting milk, sugar or sweetener in tea or coffee, as it may be difficult for a person with poor vision to do this. And help by removing clear plastic food wrapping, as they are more difficult to see for people with severe vision loss. Most people with poor vision need extra lighting to read, do craft or look at photos. Place a lamp behind them so the light comes from over their shoulder. Direct sunlight can be uncomfortable for people with poor vision. Do not have the person sit looking towards the window when watching TV. Bright light from the window can be very glary. Don't forget, when going outside, sunglasses should be worn, as glare can be uncomfortable and make their vision worse. If someone wears glasses, these should be easily identifiable and cleaned regularly. A useful tip is to keep a photo of the glasses or a photo of the person wearing their glasses in the top drawer so that you know and can check they are wearing the correct glasses. If they have multiple pairs of glasses, these may have to be labelled for better identification. Alert your line manager if you think the person's vision is worsening. The person's care plan may need to be changed. We hope this training has helped you better understand the care needs of people with poor vision and blindness. This training resource was funded by the Australian Government and developed by the Macular Disease Foundation Australia. For more information, please visit www.mdfoundation.com.au or call 1800 111 709.